I'm Dr. Monica, consultant in neonatal perinatal medicine, head of the department of NICU Emirate Specialty Hospital. So we are taking how do we counsel our parents whenever we are doing any kind of procedures. So now today I will be talking about when we need to give surfactant to our babies. What do we need to talk to them? Now, first of all, why do we need to give surfactant? So we have to tell to the parents that our baby is born much before time. The baby should have been born at 40 weeks. And definitely, when the baby is inside, for that 40 weeks, it's developing all the organs, and so is the development of the lungs. So, the development of the lungs is in the form of structure as well as in the form of some um, enzymes and some thing called surfactant. Now, the surfactant is doing what? So, we have structures in the lungs which are alveoli, which are balloon-like structures, and these balloon-like structures where we are breathing air and the oxygen is getting absorbed and the carbon dioxide, which is bad gas, is coming out. So to have that happen, the balloon-like structure has to be kept open. Now, the surfactant has in effect on the surface tension. It reduces the surface tension of this balloon-like structure so that the balloon-like structure doesn't collapse. So, if we are born before time, this surfactant is less, and hence this balloon-like structure surface tension is higher and it collapses. So, to have this surfactant and a good maturity of the lungs, our obstetric colleagues have already given an injection to the mama, that is steroids. Now, because that's a good news that our mother got the steroid, otherwise the baby's respiratory issues must have been much more worse than how they are now. Now, also it is dependent on the time between the steroid was given and the baby is out. So one, that both the doses of steroid should have been given, and it is that its good effect starts coming after 24 hours and takes 48 hours to sometimes more time um, for the steroid to act. And even when it is given the full course and the proper time, still 100% definitely it is not going to be effective. But it will definitely, from worse to a moderately worse situation, it may come. And that's the reason we want to give surfactant to the baby, because we still are nagging this surfactant and the baby is breathing hard to actually oxygenate himself. Now, when we have to give surfactant, there are two types of surfactant which are available in the market. One is from the cow slung and the other one is from the pork lung. Now, both of them has a religious and cultural issues. So I need to tell something to my dear parents that it's not being ingested, nor it is being injected into the vein. So culturally and religiously, both should not be coming into that category. And because we are giving directly to the lungs, so it doesn't get absorbed anywhere in the body. And if we have to decide which surfactant to be given, I would like to tell you that the coke surfactant is a concentrated surfactant. So when we are giving 1.25 ml per kg, it is equal to 4 ml per kg of the surfactant which is taken from the cows. So when we give 2.5 ml per kg, it is actually double the dose of surfactant given by the cow, 4 ml per kg, which is already a very large volume. So in a small volume, we can give a large amount of surfactant to the baby. So this is a good news about the pork. And that is why when we give the pork surfactant, The results are quite quicker, and we don't need to give second dose. We might be avoiding ventilation, and also this will help the baby to come out quickly. And that's the reason I prefer giving Pope surfactant. Now, once we have decided, you can take a call and you can decide which one to be given. This is my take, and the evidence suggests that when we give Pope surfactant, it is causing quicker results, and it is actually helping the babies even for a chronic lung disease. Now, once we have decided which surfactant to give, we have two ways to give surfactant again. So one, the older way was that we were putting a bigger tube inside the baby's airway, and we were giving surfactant, and at the same time we were giving pressures to allow the surfactant to go in. Now, when we are giving this pressure, it may actually harm the baby's lungs because of the pressure, and hence we have come up with a new technique where we are giving through the small catheter. We are giving, the baby is awake, baby is breathing of his own, and we are just putting a thin catheter and we are giving the surfactant when the baby is breathing of his own, and we don't require to give pressures on it, so the lungs are quite safe and protective with this mechanism. We have been doing this past 3-4 years in our unit, and we have got a very good result. So this is what we are going to use. Now, even this method is not without pain and not without problems that the baby's heartbeat may go higher or lower, baby may hold breath on this. So that's why we need to help our babies, keep them calmer, relieve their pain, and hence we will be giving two injections, one for the pain and the other one to take care of their heartbeat, and it should normalize. So these injections we will give before we give the surfactant. Once we have given the surfactant, we will continue to baby to be on the this small machine, so that the baby's lungs remain open. Now, if you will ask me what are the side effects which we can expect, the baby may hold breath, as I said. The procedure may have to be stopped, and then we might have to give some bagging or more oxygen. And also some surfactant may be lost because it may be spilled out, though we try it not to happen. And the third thing which may happen, the tube may get blocked because of this surfactant. So if anything of this happens, we will be able to take care of it. And lastly, any kind of surfactant may have some kind of rarely bleed in the lungs. So if that happens, we will let you know. But mostly we have not seen this to happen in our unit. So we are all set, and if you have to ask any questions, you're free to ask. So we will be more than happy to answer any of these